Hello there, and welcome to This Explainer. I am so incredibly glad you've joined us today. As we navigate our golden years, I think we all really share one fundamental goal. We want to live entirely on our own terms, right? We want to feel completely safe in our homes, confident in how our bodies move, and absolutely in control of our own decisions. But let's be honest for a second. Sometimes sudden aches, a little loss of balance, or hearing conflicting medical advice can make maintaining that precious independence feel, well, kind of overwhelming. It's a lot to handle, but we are going to have a calm, practical, and really open conversation today about how to protect your independence from every single angle. And I mean both in the doctor's office and right inside your own living room. By the time we wrap up our time together, you are going to have some highly effective, totally practical tools that will leave you feeling empowered, protected, and deeply confident about your future. Let's dive right in. But before we go any further, I want to ask you a very, very important question. And I want you to really take a second and think about this. If you were to sit down on the floor right this very moment, say maybe to pick up a dropped pen or simply to stretch your back, how confident are you that you could get back up? Seriously, could you do it without struggling, without pain, without needing someone else to rush over and pull you up by the arms? Just be perfectly honest with yourself. If just the thought of getting down on the floor makes your heart beat a little faster, or if you've actually stopped doing it altogether because you're terrified of getting stuck, please know that you are not alone. It is an incredibly common fear for us as we age, but I want you to stay with me today because what we're going to discover is literally a game changer. We are going to show you exactly how to conquer this fear entirely and get you moving confidently again. You see, the fear of losing our physical independence is actually deeply connected to another kind of fear, and that is the fear of medical interventions that end up taking a really heavy toll on our daily lives. I want you to consider the heartbreaking words of a gentleman named Raymond. Raymond is a 74-year-old retired electrician, and he said this: "I felt better before they found it than I do now that they fixed it." Now, Raymond was doing incredibly well. He was still mowing his own lawn, driving himself to his Tuesday poker games, and feeling as sharp as ever. He was living his life. But a routine physical led to a test, which then led to a procedure for a harmless, slow-growing condition that he didn't even know he had. Months later, the extreme fatigue from that treatment totally took away his lawn care, his poker games, his social circle, and really, his sense of freedom. His story beautifully and kind of tragically illustrates why we have to protect our independence from unnecessary medical tests just as fiercely as we protect it from physical weakness. So our goal today is simple but powerful: to give you total control over both your medical and your physical well-being. Here is our gentle roadmap for this explainer. First, we'll look through what we call the longevity lens. Second, we're going to talk about some specific medical tests you might really want to reconsider once you hit age 65. Third, we'll explore a fascinating medical discovery known as the Independence Predictor. Fourth, I'm going to teach you 5 simple, totally pain-free tricks to stand up from the floor. And finally, we will wrap up with exactly how you can take complete control of your health at your very next doctor's appointment. Sounds good? Let's get started. Section 1, the longevity lens, shifting perspective. Okay, so to truly protect your health, there is one absolutely vital concept that we need to understand right off the bat. Think back to when you were 50 years old. Routine medical screening was pretty straightforward, right? You find a problem, you treat it aggressively, and you hopefully gain 30 healthy years. But after the age of 65, our bodies change, and that medical equation completely shifts. We need to look through the longevity lens. First of all, many of the tiny abnormalities that tests find in older adults, they actually grow so incredibly slowly that they will never, ever cause you any harm. In fact, you would outlive them without ever even knowing they were there. Second, and this is crucial, our bodies simply do not tolerate harsh medical interventions the way they did at 50. A surgery that takes 2 weeks to bounce back from at age 58, well, that might take months of painful recovery at age 75. The anesthesia can linger, causing awful brain fog. The hospital bed rest alone can cause severe muscle loss. Treating a harmless condition can actually threaten the very quality of life we are trying so hard to protect. And this brings us to something known as the Cascade effect. It works exactly like a snowball rolling down a steep hill, gathering speed and size until it becomes downright dangerous. Imagine this. You walk into a doctor's office feeling perfectly fine. On day 1, you agree to a routine screening just to, check on things. By week 2, the test flags a tiny, harmless abnormality. It's a false positive. But medicine doesn't really like to leave things alone, so by month 1, you are sent in for an invasive biopsy. By month 2, that biopsy causes an unexpected complication, maybe an infection, some internal bleeding, or nerve damage. And suddenly, by year 1, you have completely lost your independence, all because of a condition that never would have bothered you in the first place. The cascade, my friends, doesn't start with the surgery. It starts with saying yes to that very first unneeded test. Section 2. Tests to reconsider after age 65. Now let's calmly walk through 5 specific tests that frequently trigger that dangerous cascade effect for adults over 65 who have absolutely no symptoms. We're going to take our time here because this is so important. First up is the routine PSA test for prostate cancer in men over 70. This is exactly what happened to our friend Raymond. The test often finds a really slow-moving, totally harmless tumor. But instead of just leaving it alone, doctors frequently want to treat it with radiation or surgery. And that overtreatment can permanently ruin a man's energy, his continence, and his overall quality of life for a cancer that wasn't going to harm him. Next is the DEXA scan for bone density. A low score here often results in doctors automatically prescribing these strong bone medications called bisphosphonates. But here's the catch. Long-term use of these medications changes the structure of your bones and can actually cause terrible, unusual stress fractures in your thigh bone, literally the very bone they are supposed to protect. Third is the routine cardiac stress test. If you have no chest pain and you are feeling fine, taking this test can result in a false alarm almost 40% of the time. That false alarm leads to doctors threading tubes into your heart to place stents. But the reality is, studies show that for stable patients, stents do not extend your life or prevent heart attacks any better than a simple daily walk and managing your blood pressure. But they absolutely do expose you to severe surgical risks. Fourth, we have the carotid ultrasound to check the neck for stroke risk. Finding a silent blockage here often leads to surgery to clean out the artery. The terrible, tragic irony is that operating on a stable, harmless blockage can accidentally cause the surgeon's tools to knock a piece of plaque loose. That plaque then travels to the brain, actually causing the exact stroke they were trying so hard to prevent. Finally, the routine colonoscopy for folks over 75 without symptoms. Think about Margaret, a 78-year-old retired teacher. She agreed to a routine colonoscopy. The harsh bowel cleansing liquid she had to drink the night before caused such severe dehydration and kidney stress that she actually ended up in the emergency room for 5 days. She suffered terribly for a test she didn't even need. Now, we share all this not to scare you. Absolutely not. We share this to show you that questioning these tests is the absolute smartest thing you can do for your body. Now, I want to be very clear. Declining a risky test does not mean giving up on your health. Not at all. It simply means shifting your focus from treating numbers on a medical chart to treating your actual life. Instead of hunting for false positives with invasive tubes and scans, you focus on what actually works after 65. You prioritize optimizing your sleep. You manage your blood pressure naturally. You practice practical, safe physical activity. These natural lifestyle choices do significantly more to protect your heart, your brain, and your body than a risky surgical procedure ever could. This is about you taking your power back. In fact, the medical literature actually tells us that the single most effective intervention for reducing fractures in adults over 65 is not medication, it is fall prevention. This is profoundly true. Do you remember Gloria, a 72-year-old grandmother we touched on earlier? She took a routine bone density test, was put on strong medication, and 3 years later, her thigh bone fractured simply from the medicine reacting poorly in her body. The actual scientifically proven way to protect your bones isn't always a pill. It is learning how to safely move your body. It's doing something like Tai Chi, which can improve your balance and reduce your fall risk by nearly 50%. It's removing loose rugs in your home, ensuring your hallways are well lit, and installing grab bars in the bathroom. Real prevention is practical, not just clinical. Section 3. The Independence Predictor, the floor test. So we've talked about the medical side, but what about the physical side? Is there a single test that predicts how long you will live? A senior orthopedic surgeon recently revealed that the most underrated test in modern medicine is actually not checking your cholesterol or your weight or even your blood pressure. It's something much more fundamental, much simpler. It is your simple ability to sit on the floor and get back up without anyone helping you. Let me share something that will really put this into perspective. A massive study followed over 2,000 older adults for 6 years. They found that seniors who struggled to get up from the floor were 5 to 6 times more likely to pass away within those 6 years compared to those who could get up easily. 5 to 6 times. Now, why in the world is that number so high? Well, because getting off the floor is a full body system check. It requires your heart to pump blood strongly against gravity. It requires your core muscles to stabilize your spine. It requires your hips and knees to bend and bear weight, and your brain to quickly coordinate your balance. Losing the ability to stand up from the floor is a massive warning sign that our overall physical independence is slipping away. But please, take a deep breath right now, because the solution is entirely within your reach. You are not stuck. Hear me when I say that. If you have lost the ability to get off the floor, it is not lost forever. The same researchers discovered something truly beautiful. They found that seniors who practice specific, deliberate floor-rising techniques improved their ability to stand up by an astonishing 47% in just 8 short weeks. Almost 50% better. And they did this without surgery, without heavy weightlifting, and without any expensive treatments. Your body is highly adaptable no matter your age, and it is entirely capable of relearning how to move safely. Section 4, Tricks to Stand Up, 5 Easy Methods. So I'm going to teach you the exact step-by-step techniques that orthopedic surgeons recommend to help you get off the floor with total ease and zero pain. You can practice these right in your living room. The first is the hand press method. Look, if you try to stand up using only your legs, your knees and your lower back take terrible, terrible pressure. Instead, place both hands flat on the floor beside your hips and press down hard. Using the strength of your arms and shoulders takes the painful load right off your aging knee joints. It's like having a built-in set of crutches. The second is the side sit transition. Instead of trying to stand straight up from a cross-legged position, which is really hard, simply roll your weight smoothly onto one hip so your legs rest to the side, kind of like a mermaid. This completely eliminates those painful twisting forces in your lower back. Third is the furniture-assisted lift. Please, never feel embarrassed to use a sturdy chair or a heavy coffee table to push yourself up. By placing your hands on a stable surface, you effectively reduce the strain on your leg muscles by up to 50%. Using furniture is a sign of smart mobility. It is absolutely not a sign of weakness. Fourth is the kneeling lunge rise. From your hands and knees, plant one foot flat on the floor in front of you. Using that strong front leg to push up actually rebuilds the specific hip and glute muscles that tend to weaken as we age. You see, instinctually, when we panic on the floor, we try to just push straight up with our legs. We try to force it. But as you might have experienced, that causes awful joint pain, dangerous twisting forces in the spine, and it makes us feel terribly unstable and wobbly. By contrast, when we use the proper techniques, when we smoothly shift our weight to the side and use our arms and furniture for help, we spread the physical workout across the whole body. We are aligning the spine exactly how it was designed to move naturally, and we protect our joints from unnecessary wear and tear. It really makes movement feel possible again. It takes the struggle away. Let's bring it all together with a very smooth 3-step method that is proven by the Cleveland Clinic. I want you to close your eyes for a second if you can, and just visualize yourself doing this with me. Step 1, sit to side. From sitting on your bottom, smoothly and gently roll your weight onto your right hip, bringing both of your legs to the side. Nice and easy. Step 2, side to kneel. Press both hands firmly into the floor near your hip and slowly push your upper body up, transitioning onto your hands and knees. Once you're stable there, lift your hands off the floor until you're in a tall kneeling position. Step 3, kneel to stand. Plant your strongest foot flat on the floor right in front of you. Place both hands on your front thigh or on a nearby sturdy chair if you have one, and smoothly push yourself up to a standing position. It is one continuous, deliberate movement, like a slow dance. Just 5 minutes of practicing this specific sequence a day can completely, and I mean completely, change your physical confidence. During a study of these very techniques, the researchers met an 82-year-old woman who had not dared to sit on the floor in over 12 years. 12 years! She was so utterly terrified she wouldn't be able to get back up that she missed out on countless family moments. But she began to practice these specific flowing movements near a sturdy couch for just 5 little minutes a day. And within just 5 weeks, she safely got down on the floor to play with her 2-year-old great-grandson for the very first time in over a decade. Her family wept with joy. That, my friends, is the life-changing power of simply learning how to move your body safely and mechanically correctly again. It is never too late. Section 5, taking control of your health. So I encourage you to grab a pen and paper right now. Seriously, grab one. These 5 questions will transform you into a protected, highly confident patient. The next time a doctor suggests a routine test and you feel perfectly fine, I want you to calmly ask them, 1, what is the false positive rate of this test for someone my age? If they say the test is wrong 30% of the time, well, now you have vital context. 2, if we find something, what are the realistic treatment options? Would the treatment involve heavy radiation or surgery that could impair my daily living? 3, what is the actual procedural risk of that treatment? Does it carry a 5% chance of stroke or a severe infection? 4, what happens if we simply monitor this carefully instead of rushing to treat it? You'd be surprised. Often, doctors will admit that watchful waiting is incredibly safe for slow-growing issues. And 5, what is the most effective, non-invasive lifestyle approach I can take instead? Asking these practical, respectful questions changes the entire dynamic of the room. It stops the dangerous medical cascade before it even begins, and it ensures your doctor is treating you as a whole person, not just a statistic on a chart. Well, we have covered some really critical ground today, from stopping the medical cascade to mastering the actual mechanics of getting off the floor safely. You now possess the tools to navigate the medical system safely and the physical knowledge to move your own body with incredible confidence. I want to leave you with one final empowering question to think about. What step will you take today to protect your independence tomorrow? Will you write those 5 vital questions down on a note card and tuck them in your wallet for your next doctor's appointment? Or will you clear a little space in your sturdy chair and just mentally or physically practice that sit to kneel to stand sequence for just a few minutes? You have the knowledge now. You have the power. Your golden years are yours to enjoy, safely, confidently, and completely on your own terms. Thank you so much for spending this time learning with me today. It's been an absolute pleasure. Take care of yourself.